is your pharmacist Sidra, and welcome to another episode of Responding to Your Comments, where I answer your health, pharmacy, and beauty, or even career-related questions. So let's get straight into it. Okay, the first question that I have is from Diego Du. He says, I've been using Metformin for almost a year now, and I have all the symptoms of vitamin B12 deficiency that you mentioned. Does Metformin cause vitamin B12 deficiency? Diego, thank you so much for your comment. Metformin is the generic name for Glucophage. It is a prescription medication which is used to treat type 2 diabetes. In some cases, it's also used for hormonal imbalance. And this question is from the vitamin B12 video. And in this video, I talked about the signs and symptoms of vitamin B12 deficiency and its treatment options. Now, to answer your question, Diego, yes, there is some evidence that long-term therapy with metformin may be associated with vitamin B12 deficiency. And the mechanism, I want to say, for this is not fully understood, but it is thought that metformin may interfere with the absorption of vitamin B12 from your gastrointestinal tract. So if you are using metformin and you experience fatigue, weakness, also loss of appetite, or any problems with your memory or focus, then that could be because of and actually those are signs of vitamin B12 deficiency. Well, vitamin B12 is an essential nutrient which is required for many important functions in our body, and it plays a major role in the memory and focus. It also helps produce red blood cells and literally a lot more. It does a lot for your body than we can think. It's normally not a well-recognized vitamin deficiency, something which kind of, gets overlooked, but it is a very essential vitamin. I'm not gonna go into much detail here because I already have a video on it. I will put the link for you in the I button and also in the description, so do check that out. But I want to say that if you are taking metformin and you have been diagnosed with vitamin B12 deficiency, the most common treatment for you would be taking a vitamin B12 supplement, because this vitamin is something that your body does not produce on its own, so you have to get it from external food sources. Okay, so you can get it in a pill form, in a chewable tablet form, or a nasal spray, or just increase your vitamin B12 food sources. And in some cases, another thing to remember is that in some cases, metformin dosage may need to be adjusted, or just in general, if the B12 deficiency is way too much and you're having a lot of those gastrointestinal side effects which are associated with metformin, you may have to just discontinue the medication in order to correct that vitamin B12 deficiency. That's something that your healthcare provider will determine what the best course of action would be based on your specific situation. So in general, Diego, I would recommend that if you think you have vitamin B12 deficiency, get a diagnostic blood test and see a provider for a proper course of action. I wouldn't recommend you start taking vitamin B supplement on your own without checking with your provider or without actually getting a proper blood test. I hope that helps. All right, moving on to the next question. The next question is from Justin Thompson, which is, what is the best age to start multivitamins? Thanks in advance. Well, Justin, thank you for your question. I want to say that there is no specific age at which we can say like, okay, now you're 12 and you should start taking multivitamins. The decision to take multivitamins should be really based on an individual's nutritional needs as well as their overall health and lifestyle. If someone has, let's say, food allergies, diet restrictions, or any underlying health conditions that don't allow their body to absorb proper vitamins, then after proper health evaluations, yes, vitamins can be started at an early age. Like, for instance, in breastfeeding babies, it is recommended to give vitamin D since breast milk lacks vitamin D. And but in general, if a child is taking, let's say, cow's milk or like a baby formula that is already fortified with vitamin D, then you don't need a D supplement. So in general, overall, it's important for everyone to consume a balanced diet that includes a variety of nutrient dense food in order to meet their nutritional needs. Because if you are eating a healthy nutritional diet, you don't really need vitamin supplement. But there are some situations in which multivitamins may be beneficial. For example, if older adults have a hard time absorbing certain nutrients from their diet, because with age your system kind of slows down, right? And in that case, a multivitamin may help fill any nutritional gap. Also, for pregnant women, that's a great example. Or women who are breastfeeding, they may need additional vitamins just to ensure that they are getting enough nutrients, not just for themselves but also for their baby. But in general, I want to say the bottom line is that if you are considering to take multivitamins, definitely let your provider know. And if you are taking other medications in addition to multivitamins, talk to your pharmacist to get the best personalized recommendation and rule out any interactions, because sometimes the multivitamins really decrease the absorption of certain medications, because a lot of multivitamins have calcium in it, for example. And if you are taking certain antibiotics, then you have to space those multivitamins from them, because calcium containing multivitamins or some of the other multivitamins can decrease the absorption of the antibiotics. And I hope that helps. All right, let's move on to the next question now. And the next question is from Nicole325. And she says, I scheduled to get my COVID vaccine 3 days from today, and I just recovered from having COVID. How long should I wait to get vaccine? Please answer. I have not been able to get a proper answer from anywhere. Hey Nicole, I hope you are feeling well. This is a great question. I did respond to your comment briefly and answered your question. I hope that helped, but this is such an important question that I get asked on day-to-day basis. So I thought, why not make a video on it and explaining it in detail. So here's the thing. If you have previously had COVID and you recovered from it, CDC recommends that you wait at least 90 days before getting vaccinated. And this is because the immune system typically produces a strong response to virus after an infection. And it is thought that this response may provide some natural immunity for some period of time. We are not sure yet that what's that duration of time. It's not fully understood, and we don't know how long this immunity will last. But the bottom line is that even if you've had COVID, you can still benefit from getting vaccine. You just have to wait 60 to 90 days before you get the vaccine. The vaccine which is currently available has been shown to be highly effective at preventing severe illness or COVID related deaths, and also it may help prevent the spread of the virus to others. So for those of you who think that, oh, I've had the natural immunity because of getting COVID and I have the natural antibodies, yes you do, but those antibodies don't last in the system for extended period of time. And also think about it, you may have that immunity, but maybe people around you, what about those elderly people, or what about those kids? Maybe they don't have the immunity, and maybe you are carrying that virus, but you're just not sick because of those antibodies, but people around you may get sick because COVID is very contagious. So I hope that answered your question in detail. All right, I think we still have time for one more question, so let's see. The next question I have is from Mina295, and she says, I am nursing my 6 months old baby boy. I recently got a job that requires me to get hepatitis vaccine. Is it safe for me to get the vaccine while nursing? This is another great question. A lot of people wonder whether they can get vaccine while they are pregnant or breastfeeding. In general, all the vaccines are totally safe to get while you are pregnant or breastfeeding, with the exception of some of the live vaccines. Live vaccines, you don't want to get when you're pregnant, and if you're breastfeeding, you have to consult with your doctor. But in general, Mina, excellent question. First of all, congratulations on your job. And to answer your question, yes, it's totally safe for you to get your routine vaccine while you're breastfeeding. And this is because some of the vaccines may actually provide some indirect protection to your baby, as the antibodies from the vaccine are going to transfer to your baby through breast milk. And the only vaccine that I don't recommend getting while you're breastfeeding is the yellow fever vaccine, unless you're traveling to certain countries which require proof of this vaccine, in which case it is unavoidable, I guess. And in such instances, I would definitely recommend that you check with your healthcare provider, who can determine whether the benefit of the vaccine outweighs the risks. All right, guys, it's time for me to go now. Thank you so much for your comments. I love reading them, and please keep interacting with them through comments, messages, DMs, whatever you prefer. And keep me in your prayers. I'll see you guys next time with another episode of responding to your comments. Until then, take care. Bye. Hey guys, if you found value in this video, give it a thumbs up, share it with your friends and family, and remember to subscribe to stay up to date on new weekly videos.